Good afternoon to all and a very warm welcome to this week's ISNTD Connect, our regular meetings here at the International Society for Neglected Tropical Diseases to explore and discuss all things around tropical diseases. If you're new to the series, my name is Marianne Comperen and it's my pleasure today to join you on behalf of the ISNTD for this week's session, where we'll be looking at dengue and more specifically dengue data. Which data is publicly available, what platforms exist to collate and share this data, and what are some of the next steps or perhaps gaps that still need to be overcome to increase the publicly available data on dengue and to facilitate its adoption, all importantly, to inform and support global control efforts. The timing for this session couldn't be more appropriate as 2023 draws to a close. It's been very concerning in terms of dengue outbreaks and expansion, with numerous and really varied countries, whether Bangladesh, Peru, Bolivia, but also others such as Sudan, witnessing a resurgence of dengue, and in others, a buildup of unprecedented autochthonous cases across new areas in, for example, Europe, sending alarm bells ringing. So against this backdrop, it's my pleasure today to welcome our panelists who will be sharing with us some of the ongoing initiatives and work to increase publicly available data on dengue, as well as efforts to make this accessible and useful to disease control programs. So please join me in welcoming firstly Dr. Leonardo Bastos. Hi, Leo.
Hi.
Hello. Leo, you are a senior researcher at the Oswaldo Cruz Foundation in the PROCC, or the Scientific Computing Program. You will talk to us about the development of InfoDengue, which is a real-time Brazil-wide Arbovirus analysis platform that, in partnership with the Ministry of Health, directly informs vector control decisions. So thank you so much for being here and sharing that with us. Our next speaker will be Dr. Oliver Brady. Hi, Ollie.
Hi, Marianne.
Thank you for being here today. You're Associate Professor at the London School of Hygiene and Tropical Medicine, and you'll be talking to us about the development of Open Dengue, publicly accessible database of dengue case data, and the ways in which this improves our understanding of the drivers of dengue across the world, whether it be from climatic to socioeconomic factors. So thank you so much. And our third speaker, who I also welcome very warmly, will be Dr. Diana Rojas Alvarez. Hi, Diana.
Hi, Marianne. Hi, everybody.
Hi. You're Technical Officer at the World Health Organization in the Emerging Zoonotic Diseases Department, and you will tell us a lot more about the WHO's work through the Global Arbovirus Initiative, the GLI, and the aim to establish a global arbovirus dashboard for real-time monitoring of these arboviral threats. So a really exciting, very timely session, and with lots of practical applications and resources for everyone listening in. So thank you so much for being here today, panelists. Thank you to our live audience as well. Another very warm welcome. And without any further delay, it's my pleasure to hand over to you, Leo, for our first presentation of the session. Thank you so much. Over to you.
Thank you very much. Thank you very much, Marianne. I'm going to share my screen now. Thank you very much. I'm going to talk about the InfoDengue, which is an early warning system for arboviroses in Brazil. It started as monitoring dengue, but then chikungunya and Zika were added, and it started as a research program, as a research project. And I'll talk about what we do and what we have and what data we have as well. So InfoDengue, there is a website that I invited everyone to at some point visit it. It's info.dengue.mat.br, which is a website that we update weekly and with what's going on in dengue and chikungunya, mainly these two in Brazil. So what do we do? What's the InfoDengue initiative? It's essentially an analytical tool for surveillance, for aiming for surveillance teams look at it. It's an early warning alert system that started in around 2015. it started small. We are basically looking at Rio de Janeiro data, and then we have this real-time model. They send us the data. We treated the data and provided an alert system based on colors, in 4 colors. If it's green, if everything is fine, and then it goes to yellow, orange, and red. And it's a model-based assessment. So we gather the data, and we treated the data. So we have dengue data, so the cases, and we have also weather data, which is temperature and humidity. And using the weather data, we can say whether it's the conditions are good or bad for the mosquitoes, and so what we call the receptivity detection. And we also could combine information of weather and cases in a reproductive model to say whether we are in a sustained transmission period, or if we are in this, if you could detect the sustained transmission. And also based on the data, we could see if the number of cases passed the threshold. And if it passed a particular threshold, we could say, well, we're in a typical incidence detection, so we are in an outbreak or an epidemic. But we're basically in a typical scenario, so we have that. So we have plenty of models. I'll discuss the models a little bit. And but before that, I'm talking about data. So what data do we use? So the Brazilian government, we have this unified health system. It's called SUS. It's the largest government-run public health care system in the world. It's like the NHS in UK. It's based on the UK version, but it's for the whole Brazil country. And in the system, when there is a suspicion of a dengue case, when a doctor suspects a dengue case, it must notify that case. It's mandatory to notify dengue cases in Brazil. So we have a system for that. It's called SINAM. It's a system that all dengue cases are in there. And the individual level data is freely available. It's not in real time, but you can download the anonymized information data from the Brazilian website. You can get that, but it's not in real time. In InfoDengue, we receive the brute data. We receive the data from the Minister of Health, this SINAM data. So every week they send us the data, and then we treat the data. We share the aggregate data at seat level. So we calculate incidences, we correct delays, and talk about that later. So we have this data, the suspected cases for dengue. Well, actually dengue, Zika, and chikungunya, but mainly the most frequent here in Brazil is dengue. We also have some weather data. So it's basically we have some. So if you see this map here, there is a lot of dots. Those are meteorological stations that the data is open. And we get this data from temperature, humidity, and estimate the average temperature in all cities in Brazil. So it's over than 5,000 cities. So we do that weekly based. Then what we do, so once we have that, so we have the weekly dengue data notifications since 2010 for all 500 and for all 5,000 cities. At municipality level, it's admin 2. We have the weather treated, so we share the maximum, mean, and minimal temperature and humidity per city per week. We have population data from Brazilian Official Statistics Office. It's called IPGE. And we also provide estimates. So we correct the delays because the data is delayed. We calculate RT, reproductive numbers. We calculate the probability of that reproduction number is greater than 1. We have several statistics that we can share. We share. And if you go to the InfoDengue website and you click in this data, and you can get an API to download this treated data, and there is a tutorial there. So, and then there is a notebook in R and Python. So how you can download data, and so it's basically the data. We have plenty of free data here in Brazil, and we use it. This data. Well, this data is a lot of people use it for the papers and everything. So it's very nice to have this data. And so what we do? So when we get the data, we need to treat it. So if you see this time series here, that's a time series from that week, the 11th week of 2023. And it seems that the cases are going down, but basically they are not going down. They are basically delayed. So the history, how does that work? So we have this mosquitoes. Indicates an infection. Then this infection, the person get the symptoms onset. Then the person at some point go to the doctor. The doctor suspects that case is dengue, and it types into the system. It doesn't necessarily types on the same day. It takes some time. So it may be a paper that he need to put that paper in a computer. So the computer may not have internet. You may have a lot of things that there is a delay between the case being identified and the cases get into the system. But also there is a long period, well, not necessarily too long, but there is a period between the symptom onset and when we know the cases. So for instance, we have here 4 cases that are known. 1, 2, 3, 4 cases that are known. There is this other 2 cases that the system doesn't know. Well, no one knows, not even the person knows because it didn't have the first symptoms. So in these 4 cases here, only 2 are in the system, these 2 here. This one and this one, they're not in the system yet. So there is a delay. So if you think that these red lines here are today, so there is a delay. So we need to correct this delay. And there are some methods to do it. And these methods are called casting, but there are some methods. So we have a paper on that corrects. So that's the same time series, and this is the series corrected. So we have some papers on that, and based on the corrected series, we calculate the reproduction numbers, and we evaluate epidemic thresholds. We use historical data, calculate threshold levels, and we see whether we cross that threshold or not. So given so then we have the RTs, we can see whether it crossed the threshold or not, and with this information we can use to feed our system. And the first analysis that we do is basically we use historical data, and for each city every year we evaluate how we got the weather data. We have this tree regression, and so we have the temperature here 3 weeks, temperature 1 week, and then we have humidity, the minimum humidity in 3 weeks. So we have several combinations of a tree regression, and for each city we have the best one, and we see, well, like this one, we see that this combination here of leaves leads to a large RT. So that means that when the temperature is above 27 degrees, the maximum temperature is above 27, the humidity is below this value, and if the incidence it's greater than 107, is this number here. So then we got these favorable conditions for the disease arrive. So we have this. This is for one particular city. So other cities you may have just, the temperature may not be that important because the northeast cities in Brazil, the temperature is really stable throughout the year. So basically what changes is the humidity. So in the southeast, here in Rio, where I am, the temperature plays a more important role. And so we have that for all cities once a year. So we have this analysis to do the receptivity analysis to say whether it's yellow or not. So given the corrected values and the RTs, we can estimate the RTs, calculate the probability of the RTs be greater than 1, and if the RT is greater than 1 for 3 successful weeks, then it's orange. So it's kind of, we are in a scenario that you need to pay more attention. And if the estimated cases cross a threshold, and if it cross a threshold for 3 weeks in a row, then we have an atypical incidence scenario. So we have this this time series. So we have here, like here is yellow because the estimate cases is above the line, but we need to have that in a sequence of 3. And this one was an epidemic period. So we have these colors here, which makes easier for the decision makers at some point, but we could look at the time series directly. So we have these 4 color systems, and then we put that in the website, and then when you go to the website, we could see that in space. We could see how many cities are in the favorable environment for transmission. We know based on last week, it goes down. There are less cities now. We see this distribution here. We have plenty of data. So that's the time series for this year. So this year was a low activity here in Rio, but not in Brazil. Like there was this expansion of dengue for the south of Brazil. So the number of cases in the south increased a lot. So we have a lot of dengue cases here in Brazil. But in particular in Rio de Janeiro, we had an epidemic year, but it was a low activity. So that's what this time series is here, is showing. That's for Rio. But we have that for all cities. So if you go there and click it, and for all Brazilian cities you can get. Obviously, when a city is in a low intensity or kind of a small city, the estimates are poor, but it works in the vast majority of the cases. So basically, the InfoDengue has been used as a complementary tool to monitor arboviruses in Brazil. So now the Minister of Health is using, so they are sending us the data for the whole country. But also some states and cities are using, so they have the InfoDengue system as part of the decision process to decide whether to do. So this is basically mathematical statistical models are always being studied and improved, and if something better arises, we implement it in the system. So we are always doing it because primarily we are a research team. So we are always doing something to improve our models. And the next target now, we are starting we are starting implementing some forecasting. It's not on the website yet, but we are trying to do short and long-term forecasting for dengue here in Brazil. So a special thanks. So obviously I'm going to thank the InfoDengue team, namely the PIs like Cláudia Codesso, Flávio Coelho, and Oswaldo. These 3 are the PIs from the InfoDengue since the beginning. I need to mention the health workers there and the typing this data, which is a really important job. So it's really important what they do, and we need to reckon that it's a very important job. Obviously, the financial supporters, because all the system depends on scholarships and everything. So, and for students, and so we have a lot of. We need some financial support to make the system run, and that's my contact. So if anyone wants to talk about anything about InfoDengue, there it is. So thank you very much.
A very big thank you to you, Leo. Thank you so much for this very informative presentation, allowing us to jump almost behind the scene, jumping right in and gaining this very important insights into the practicalities of collecting and, more importantly, sharing this data. So it's been wonderful. Thank you. And I'm sure that there will be lots of questions or comments coming up from the audience. I have posted a link to the platform if anyone wants to explore this, and we'll come back to this very shortly. But before that, I'd like to hand over to our second speaker. Over to you, Diana.
Thank you very much. So now I will briefly talk about the Global Arbovirus Initiative and the efforts to work towards a Global Arbovirus dashboard and why it is so important for our member states or the countries that are part of WHO. Okay, so the Global Arbovirus Initiative focus on 4 specific Aedes aegypti-borne arboviruses: dengue, chikungunya, and Zika, and urban yellow fever, which is mostly frequent in the African region. We know there are hundreds of other arboviruses circulating in the wild and getting ready to have spillovers in the human population. But what we have considered is that if we are able to understand the transmission dynamics and we have the data and we are early to detect, do an epidemiological investigation and respond to these arboviruses, then we will be able to early detect any other arbovirus that might be emerging. We currently have about 4 billion people at risk for Aedes-borne infections worldwide, and this number is going to increase by 1 million in the next 2 decades due to climate change. So as we are approaching the COP28 climate change UN meeting that is going to start tomorrow in Dubai, and for the first time, health is going to be discussed as a main topic in this climate change conference. Just to bring into the table that diseases are the human face of climate change. So we talk about increasing temperature, we talk about the more events and increasing humidity and monsoons and catastrophic climatological event, but that is the effect of climate change in the planet. But the effect of climate change in humans are these type of diseases, and arboviruses and dengue are a good sentinel group of diseases to actually monitor the effect of climate change because it has a direct impact on them. As you can see in this map here, we have about 130 countries that are reporting dengue, 115 that report chikungunya, and 91 countries that have reported at least one Zika case in the last few years. As you can see there, most of the countries that are in blue have the transmission of more than 3 of these 4 viruses. Then in green, you can see the ones with transmission of 2 of those 4 viruses. And then you can see in the other colors, the countries that have just transmission of 1. We currently are facing large epidemics in West Africa, in Southeast Asia, mostly in Bangladesh, and we are really worried about the current situation that is going to start because the dengue season is going to start in the south of South America soon. So we are worried about dengue transmission, but also Zika has been detected more and more in the Western Pacific with some clusters in Singapore, in the Pacific Islands, and so on. So the transmission of arboviruses, even if we are not talking as much as other pathogens anymore, they are still there. So the Global Arbovirus Initiative is an initiative with 6 pillars, and the aim is to build a coalition of multidisciplinary partners and strengthen coordination with stakeholders around the globe towards preparedness for arbovirus with epidemics and pandemic potential or public health emergency of international concern potential, strengthen the integrated approach into early detection, prevention, response, and control of these Aedes mosquito-transmitted viruses, and advanced innovation and new approaches, mostly for diagnosis, medical interventions such as vaccines and potential therapeutics and vector control. This initiative has 6 main pillars. The first one that is very related and covers really well the topic that we are discussing today, which is data system surveillance and early warning systems, is about monitoring risk and anticipation. The second pillar is about reducing epidemic risk in the local levels, mostly through early detection, a quick epidemiological investigation that generates a rapid response. The third one is about strengthening environmental and vector surveillance that will lead an integrated vector control. The fourth one is about strengthening and empowering communities to prevent and prepare for pandemics. The fifth one is in innovation and new approaches. And the sixth one is about building a coalition of partners, which is extremely important because all of you are partners of this Global Arbovirus Initiative. So in this first pillar, one of the priority actions is to develop a global risk monitoring framework for arboviruses using the One Health approach. So the idea is to have in this dashboard or this framework environmental data, which was already presented by Leo, and they have been using in Brazil and many other countries, but making those tools and using that information that is available more broadly in the more than 130 countries that have transmission for these viruses. And of course, including the information on the mosquito and the information in human health. Then once we have a baseline information and then we have real-time information, as you saw in the previous presentation, then we will be able to forecast and model potential epidemic and pandemic scenarios for arboviruses. This Arbovirus initiative was launched in March 2022, and since then we have been working with different partners around the world, and we have been collaborating very closely with the London School of Hygiene and Tropical Medicine and with all his team. They supported us with the systematic review of the drivers of transmission of arboviruses because we wanted to have a global risk map for arboviruses, and the manuscript was already published. They have been working in which are the main gaps of the risk mapping of arboviruses with multiple groups around the globe. And then we currently have a draft of the mapping the risk of vulnerable areas for arbovirus transmission. Hopefully I can show it here, which is part of the hotspot mapping. Can you see my current screen? No, let me stop sharing and maybe share the new one. Okay, so here, let me see, window. Probably we bring this here. Voila. Yes. So probably this is a surprise even for Aldi because this is the first time that I show the draft of the hotspot mapping. But this is the result of a collaboration with multiple teams, and it was led by the London School, where we have very detailed information on the risk of dengue. Where we have very detailed information on the potential risk of hotspots in all over the world, where climatic variables, epidemiological variables, population density, and some other covariates related with surveillance were included. And this gives us a really nice picture of where the risk is and how heterogeneous the transmission of dengue is. So we did the same exact exercise with dengue, Zika, chikungunya, and with yellow fever. And the idea is that we are going to proceed now with the validation of these risk maps. And for this, we will need the support from the member states, from the different countries, and for projects like InfoDengue in large countries like Brazil, that will help us to validate these maps to see how accurate they are based on the information that they are producing, and how accurate they are in estimating the risk. So let me go back to my slides. Okay, good. Then we are also working with the multi-pathogen hotspot mapping with the Institute for Health Metrics and Evaluation in University of Washington, which are also supporting different exercises on different pathogens with epidemic and pandemic potential. And they are supporting us mapping the Culex-borne arboviruses, which are always in the background. We have West Nile and many other arboviruses that are transmitted by the Culex species, and then we would like to have a broader view of what's going on. So we have the first layer, which is this one that I just showed, but now we need to keep working in a global arbovirus dashboard that will have the One Health approach, and hopefully, and currently the regions are sharing multiple experience. So the main aim of this data dashboard is to have an inventory of the different data sources that are available at WHO and in other open data sources. So we work mostly with the information that comes from our country offices and goes to the regional offices. The idea is to develop an integrated global arbovirus reporting system to capture and transmit arbovirus-related data from the national level, regional level, and to the global level. Of course, not with the same granularity of the data, because at the global level, we are not going to be looking at the neighborhood information, for example. But from the local level, it might be relevant to know exactly where the hotspots are in a specific municipality or in a specific city. And design and operationalize this global arbovirus dashboard. So the idea is the reporting system and the flow of the information that we are used to. So it goes from the very local to the district level. It could be individual data or aggregate data, depending how the information is being collected. It goes to the state or the province, also individual or aggregate. Then it's aggregated in the national level. It goes to the regional level, and then it comes to headquarters or the global level. And then in the one of the layers is the integrated risk map that I just showed you with the environmental and other data sources. So that's the information that we are currently taking into account. However, the reporting is very heterogeneous among regions. So we have regions such as the Americas with the Pan American Health Organization, where there is a minimum basic variables that are reported almost in real time. And then we have other regions where just alerts or outbreaks are reported. We have some other regions that they are just starting to detect arbovirus transmission, so there is not a lot of background information. So what we are doing is trying to reconcile and see how we can put together this global dashboard. So we have dengue data reported in the neglected tropical diseases department, but it was up to 2019 before the pandemic. So the idea is to start updating. Then we want to add the information about Zika and chikungunya, which is not reported to the regional level or to the global level. Then we are working with the event-based surveillance, but the outbreak group within emergencies. So at WHO, there is a specific group that monitors alerts and events every single day, and then they follow up with the different countries to verify if it's a real alert. We work with the ECDC for these arboviral diseases, with IHME and the global burden of disease. DHIS2, multiple regions are collecting the epidemiological data using DHIS2. So the idea is to build upon what they already have and not create parallel data systems for dengue and arboviruses. the early warning systems or EWARS in a toolbox for fragile countries and territories, and also GeoSentinel travel surveillance data that is available, is publicly available. There are many opportunities for integration with open data and early warning systems. So we have discussions underway with several public health agencies and funders, research institutions, and academic groups working on early warning systems for dengue and other climate-sensitive diseases. We have the early warning system for climate-sensitive diseases, which was developed by TDR with the collaboration of many countries, the Open Dengue Project, DEMOS, which is also an early warning system that has been implemented in several countries in Southeast Asia, and that was led by the London School, but the Barcelona Supercomputing Center and other partners. We have discussions with the Rockefeller Foundation. They also have an early warning system at UNICEF and many other partners. So the idea of this global dashboard is to start integrating a little bit more this collaborative surveillance, where the countries report in real time the cases that are occurring. But then what we want is for the countries to bring the analytical tools to the local levels to allow an analysis and an early alert generation. And the most important thing is that the actions that follow the detection of the alert of the signal. So it's not just the information flowing from the local level up to the region and up to the central or HQ level, but also which are the benefits for the local levels. Sometimes the person that is collecting the data and that is reporting the data is in charge of many other diseases, and then there is not a constant analysis of the data. And that's something that the Global Arbovirus Dashboard is going to bring, giving simple endemic channels and using the tools that are already available for early warning systems to be applied in some of these countries. We also conducted an arbovirus survey, well, the idea is that information is also going to be available there. We asked about other arboviruses that are circulating. We evaluated the surveillance system, the lab system. So if we can have everything in just one place, that will be ideal. This dashboard will have a minimum list of variables that are going to be openly available, and more specific information. It could be a closed information depending on the agreements with the countries. The idea is to streamline the articulation between the different departments, defining which will be the data flow and the management, the requirements, and then the frequency of reporting. So currently we started with the PAHO dashboard, with the one from the Americas, which is the most advanced. But the Southeast Asian region and the Western Pacific region are also starting to work in their own dashboard. So hopefully by the first trimester or first semester of next year, we can have a more updated and with a global view of the arbovirus dashboard. The minimum list of variables that we would like to have in these dashboards is with the country, the serotypes that are circulating, the last epi week where the cases are reported, the total number of cases, lab confirmed, the proportion of severe dengue deaths and the population, and hopefully it can be computer-based. There are still in many countries doing surveillance in paper, and we are currently conducting a pilot study with the support of the German Development Fund to implementing the One Health approach for surveillance of arboviruses. So it's still a work in progress, but I don't want to finish my presentation without thanking all the partners and all of you that from one way or another you are doing research, or you work in an endemic country and you see patients, or you work on surveillance, or you work in the lab, and all of you are partners of the Global Arbovirus Initiative, our regional offices, our country offices, and all of our partners that support us with funding and also with expertise and other type of support in everything we do with this initiative. So with that, I want to thank you all for your attention, and this is my email in case that you want to contact me. Thank you very much.
Thank you so very much, Diana. That was a very interesting, very enriching presentation, really exciting, and in fact honored to have witnessed the draft hotspot mapping being unveiled. Congratulations on that. And it was really interesting to see all those early warning systems listed and the opportunities for integration with that. And in fact, a lot of the colleagues from those early warning systems have spoken right here on ISNTD Connect or at some of our events. So I will post a link if anyone wants to find out more, to go back and revisit those presentations. But thank you so much. And your call for partnerships was heard loud and clear. So clearly a very open initiative that everyone can contribute to. So thank you so much.
Absolutely, thank you.
Wonderful. It's my pleasure now to hand over to you, Dr. Oliver Brady, who will take us through another really exciting project, Open Dengue, covering a huge number of countries, and that just recently had an update as well. So again, I'll post the link to the resource very shortly, and in the meantime, hand over the floor to you. Thank you.
So thanks, Marianne. So, and good afternoon. So I'm Oliver Brady. So I'm an associate professor at London School, and I run a dengue mapping and modelling group. And I'm PI of the Open Dengue project, which is a UK MRC funded project that over the last 2 years has been trying to draw together as many public sources of data into one place on dengue as possible. So I'm talking here, but Joe, Clark and Young Lim have been the two people who have put all the work into this. So I'd like to thank them up front, and PROCC and Wilbert as also for their inputs in building this together. So at the start of the Open Dengue project, we were really motivated by some very simple questions, ones that you probably have as well as dengue researchers and members of the public and a whole variety of people. And they really are just very simple. How many dengue cases were there in my country last year? Is that amount higher or lower than previous years? And how does that compare to other countries or indeed globally? And what we found is it's actually surprisingly difficult to answer even these basic questions if you're just someone outside the community just trying to find these on the web. And we don't really have a common source, at least at the global level, where people can commonly look for these kinds of questions. So there are some databases depending on where you are in the world for specific areas. So Diana mentioned the PAHO PLISA system, which is really a world-leading system at the moment that if you live in various countries in Latin America, you can go and look and see what current case counts are in almost real time and look back in previous years, although I think it only goes back as far as 2015 or something. So you're limited in how far you can go back and compare to previous years, and you can't go outside the Americas. A few years ago, there was also this great project called Project TICO, which spanned more than just dengue. It was multiple diseases, but trying to work with specific ministries of health to build databases for a whole wide range of different health conditions. But it suffered the classic fate of a lot of academic projects in that the data now only runs up to 2018. So the money runs out, it's difficult to sustain over time. And it's also for only specific countries. So there really is this kind of gap of there's nothing at the global scale to be able to say there were this many dengue cases in this particular year or in this part of the world. And it kind of came back to this common frustration of, why is this information so difficult to find? And that kind of comes with a broader background as well. I think the problem there is almost the expectation, and that's because there's been a huge changing demand for public data on infectious disease outbreaks. And just to cite one example, this has probably looked familiar to many. This is the Johns Hopkins COVID-19 dashboard, a hugely useful resource cited by thousands and thousands of media outlets, used by the public all the time. And it just draws together public data on COVID from various countries and summarizes some very simple metrics that are really of interest to lots of people. So where, the relative distribution around the world over time, cumulative cases, deaths, and, over time, this has even got more complicated. The original version was even simpler than this. But really kind of underscores this, massive growth in demand amongst, not just ministries of health, but the public and the researchers to have this information available. The challenge is it's somewhat difficult to summarize this when the data is available in the kinds of forms is. So this data is out there. There's a lot of publicly available data for dengue published by ministries of health. So it's not hidden. It's part of the public record. It's just often inaccessible. So often, dengue case counts can be buried in tables that are on page 93 of a wider epidemiological report that's in PDF format, so you can't get it into your computer. Sometimes they're buried in really detailed databases, and there's lots of complex different categories of columns, and you're not sure which one to use, or there's various regional breakdowns that you can't understand without additional contextual information. And sometimes they're summarized in graphs that can be useful for looking at the data in one dimension, but can be very difficult to directly extract and process without putting up a ruler against the graph and trying to see how many cases there were in week 27 of 2007. So what we really tried to do with Open Dengue is to improve the accessibility of that. So there's a lot of work that goes into taking data from this format to this format. And that's summarized, briefly on this slide. So I just want to touch on a few things. So the first is what's called scraping. It's essentially taking data from inaccessible formats like tables into machine-readable format. So we use a variety of tools for this and develop some new approaches to extracting tables and graphs from PDFs that can be used and scaled for other things as well. So that's really sped up our ability to be able to do that over time. We also undergo a lot of standardization processes. So even things that you think are going to be quite easy, like creating a standard date format, actually has a lot of complexity. So a lot of countries report using the kind of EPI-week standard, and EPI-weeks can vary a bit country to country and use different starts of the week and so on. So there was a lot of work going into standardizing those into a universal date format, just so all records can be compared. And if we said the date format was difficult, the spatial format was even more difficult. So for countries, this is generally okay. There's a fairly internationally recognized boundary about what a country is, what it's called, how we refer to it. But lots of countries now report dengue data at subnational administrative level, and they change over time, change names, create or disappear or dissolve over time. So we spend a lot of time working about how to match data records to a specific spatial format. And in Open Dengue, we now actually have compatibility with both natural earth shapefiles and the FAO GAUL codes, so the two most commonly used global spatial files. So if you do any kind of spatial analysis, this will be great news, because you can start using the data straight away as opposed to undergoing the difficult part of matching. There's also some specific difficulties around standardizing cumulative case counts to incidence case counts. So some countries only report data in cumulative form, whereas everything in Open Dengue is in incidence. I won't go into the details about that, but essentially there's some issues around countries that report cumulative case counts that then start to decline, and it's due to some of the issues like Leo was suggesting, where reporting takes time and cases are confirmed or rejected over time, so cumulative data can sometimes be a bit misleading. So we have a series of protocols to standardize that. So last of all, the big bit of work we did was around reconciling. So the number of cases reported in a particular area at a particular time can come from lots of different sources. And by reviewing all these different sources, we were able to develop a kind of data hierarchy, saying the data we trust the most is the one that comes directly from the Ministry of Health, then regional health bodies, then other databases, then maybe publications. And at the bottom, we have more opportunistic sources, so like emergency reports from ProMedMail. Essentially, that's the order in which we trust them. So that's a simple prioritization. What we can also do with those multiple sources is a form of triangulation. And this is really important, because for some countries we'll have a really good source that tells us how many cases there were for the first half of the year, but then an absence in the second half of the year. And we don't know if that absence is due to there being no cases or due to an absence of reporting. So what we can then do is look at other sources for that location, and some of them might suggest that, by the end of the year there were the same number of cases as observed halfway through. So we can kind of triangulate between different sources to fill in some of the gaps that we had before. So another kind of unique feature of Open Dengue is the metadata that accompanies the database. So we think it's really important to be transparent around where these records come from. So for every case count in Open Dengue, it will be linked to a unique identifier, a UUID, and you can look up all sorts of additional information about that record. So we'll have the source that it came from, both how it's described in the hyperlink, the URL, so you can look at it online. We'll have the original case definition, so you'll be really clear about which column we've extracted results for a table from, and any steps that need to be done on that web page. So, drop down menus or scrolling to certain parts. It's crystal clear where the data came from. And we even recognize that URLs are not very stable at all, and they can change over time. So we've actually downloaded the original sources and archived them all in one place. So there's now there'll always be a consistent record that you can go back to and see where the data's come from. So we do this because we think it's really important to be transparent from our side about where the data comes from and how we got there. But it also goes the other way as well. We really want it to be clear, allow users to attribute where this data came from and make that as easy as possible. So using this unique ID, whatever data you do use from Open Dengue, it's really easy to build up a proper citation to the original data owners that you can then cite in your work or in any work that you produce using the data. So that's the detail of how it was made. What's in there now and how can you use it? So version 1.2, which we released a couple of weeks ago, includes about 56 million cases of dengue, which is more than we ever thought we'd get when we started this project. So we cover over 100 countries, some with data for almost 100 years. Even more impressive for us is the resolution that some countries make data publicly available at. So 97% of our data records are at weekly or monthly resolution, so we can really understand the temporal dimension of transmission. And we have subnational data for 39 separate countries, so we can understand dengue at a really fine spatial scale. So just broadly, I think these graphics are useful for summarizing some very general trends. So Brazil is still the largest contributor in terms of number of case counts to our database, but it's by no means, the only contributor. There's some large countries in Asia that contribute huge amounts of data over a really long period of time to Open Dengue. And it's a really useful snapshot to try and understand where in the world is at least reported case burden lying. The other thing we can do is plot total case counts over time, which is very useful to start looking at this question of how much has dengue grown. So there's a few different conflicting reports out there about how much reported cases have grown. So at least looking at our Open Dengue data and using some moving averages, we can say things like we think there's about a 12-fold increase in reported cases between the year 2000 and the year 2022, and perhaps more surprisingly, a doubling since 2010. So we often talk about dengue as a historically expanding, but really it's over the past decade there's still been a huge growth with some major outbreaks like 2019, and that's what you can get from these kinds of databases. So we try and summarize our spatial temporal coverage as transparently as possible. So every country is a row in this, and every year since 1990 is a column. Gray is where we don't have data, and any shade of green is where we do, with green, darker shades being better temporal resolution. So our takeaway from this is that we do have really good data coverage across lots of countries, and where we don't tend to be, smaller smaller island nations, and often this is because we don't know if no cases reported in that year is no cases happened or there were no reports. So there's a little bit of work still to be done filling historical gaps, but in terms of the proportion of the global burden that we can include in Open Dengue, we think we've got the vast majority there. So that's the data. How can I access it and start using it? So we've got multiple options for you. So the first is the Open Dengue website. So if you go to opendengue.org, you'll be able to see some various descriptions about the project. And there is also a data download application there. So you'll be able to select country you're interested in, the date range, see some basic visualizations on there and download a CSV and start doing your own analysis straight away. So that's already a very easy option. If you're going to download it and load it into R anyway, then you might want to consider something like the Open Dengue Data R package. So what I like about this is that this package wasn't developed by us at all. It was developed by Rafael Saldana, who's previously talked in these ISNTD sessions. So again, no contact, he just independently built this R package. And it's been great. Since then, we've been working on making sure it always links to the latest version. And he's developed these nice vignettes that provide code that will get you started on how to analyze some of this data. So a great example around how we just want people to use this and build their own things around it to grow the community of open data use for dengue. So we also recognize that websites don't stick around forever, and it's nice to have some longer term links to this. So the data is also deposited in repositories, both on GitHub and on the data archiving service Figshare. So you don't even need to register for Figshare. You just go to a web page and you can download the version 1.2 of Open Dengue and start using it. So what might you use Open Dengue data for? I think this is a list that we think it's really valuable for, but we're very much interested in your ideas and how you go on to use it. So we think it could be very useful for understanding the long-term climatic, socioeconomic, developmental changes and how they relate to dengue transmission. It's not before that we've been able to have a data set that spans such a long duration. So we're hoping to get some new insights into some of the longer term drivers of that could be hugely relevant. We think it's going to help improve burden estimates at the global scale. So particularly the temporal variation in those. A lot of the estimates we have at the moment are just kind of one-off snapshots. Whereas as we've seen with Open Dengue, the growth has been massive over the past decade and 20 years. We really want to use that to better understand how burden's changing. So with new interventions coming available for dengue, I think data like this gives us more power to suggest where they should be used and monitoring them over long term to see how effective they are. And finally, I think a lot of this could also help improve forecasts and future projection studies for dengue. Just more data to put at this over a longer time period at the global level is really what we need to change this. So there are a few limitations. I can see the enthusiasm of trying to get to use this, but I think that one of the most important things to clarify is some caution when making comparisons. So this is comparing data between countries, but also sometimes comparing data within countries or over time periods. So we know that surveillance systems are different between countries and they change over time, and the capacity for reporting also changes. There are various ways in Open Dengue that you can account for that. So the first is that we include a standardized case definition. So different records will represent total cases, suspected cases, confirmed cases, and we wouldn't recommend that you compare total with suspected cases. They're different measures over time. That's a kind of broad category of case definition, but we also link to the original case definition in the primary source. So you'll be able to interrogate that with more detail and then maybe link to country national guidelines to get a better understanding of what that case definition actually means and whether it's comparable to other countries or other time periods that you may be comparing records between. If that fails, then at least there's kind of the link to the primary source, and we'd really encourage people to work with the original data creators if trying to do some really important tests that rely on comparability of different data sources. So Open Dengue is also a live project, and we're really interested in seeing people contribute to it. So on the webpage, we have a contribute tab, which is a step-by-step guide about how if you know there's data for a specific country and year, you can suggest that we include it. So do take a look there if you look through those detailed coverage maps and see a gray area that you think there's data available for. So we're also working on various developments. The first is to try and disaggregate some of the data by disease severity, so severe deaths, just normal cases. Disaggregation by age and disaggregation by serotype has increased in the vaccination era. So at some point we hope to get to that. But we're very interested in collaborating because we don't have the resources to do all of this. So if there are offshoots of the Open Dengue project, that's also great. The final thing I'll just mention is also the kind of follow-up project that we're moving on this with funding from the AXA Research Foundation, and that's that we want to develop a dengue observatory that builds on the work of Open Dengue to take it into more of a real time. So I mentioned, we're motivated by how many cases are there right now. And I think what we're aiming for is something similar to what we see with the Copernicus climate bulletins, where every month they publish a summary of, climatic conditions around the world. And it would be amazing to have something similar for dengue. So this month, this region is suffering an outbreak and it's expected to get worse, so that we have this sort of systematic global assessment of where dengue is and what's likely to happen over the coming season. So with that, I'll stop talking. I'll thank Marianne once again for organising this great event. Do go to the Open Dengue website, have a play around, contact us, and let us know how you're getting on with the database. So with that, I'll pass back to Marianne. Thank you.
Well, thank you so much, Oliver, for this presentation, and congratulations on this huge body of work. Beyond that, also a huge thank you to our three speakers and their collaborators for collating, standardizing, analyzing all this data for the benefit really of a very global audience. And I know many in our audience certainly will be very eager to start using these tools. So thank you. That was really enlightening. Thank you to the three of you. And there have been a few questions in the meantime during the presentations. And so if I could just invite our three panelists to come back for a very short discussion, and anyone in the audience who would like to make a comment or ask a question, please, by all means, don't hesitate, jump in the chat and we will get round to as many questions as possible. I suppose the first thing that might spring to mind, and thank you so much for opening up really your tools and taking us a little bit into the inner workings of the platforms. But one question that really springs to mind is, from your perspective, obviously these tools are very useful to the user as they are, but from your perspective, have you found all the data that you need? And if not, what would be on your wish list? But also, what would you like to see the health or the health systems or stakeholders in this area, what would you like to see them offer to perhaps bridge some of the gaps in your resources? I suppose I will just go around in order of presenters, if that's okay with you. So Leo, over to you.
Sure. Well, thank you. Thank you very much for the question. I think here in Brazil, we have plenty of data. So the data here is completely different that you could see from the presentation that Oli and Diana presented, because the quality of data, we have this plenty of free data here, but still the quality of data, it's not that good. So we have some information, but the data is not well filled, and the quality of data could be better. So especially, Oli presented a case definition slide. And that's really important because we have suspected cases, probable cases, confirmed cases if a test was done. And that messes everything, because if you look one of these series, it may be different from the other. And there are lots of, especially when you are in a place that there are more than one Arbovirus going on, because you may have chikungunya going on, and like when you have the initial symptoms, you can't really separate these two diseases. So we need some more lab data as well. But still, I'm talking about in a very in a perspective that we have very good data compared to other countries, as Oli showed that the big ball from Brazil, but I don't think that we are the one that we got the large number of cases. Maybe we are, but I don't know. but at least we are the one that reported more. And well, yeah. So we still need some quality data, some lab data, some better quality information that we don't have. So I think that's my answer.
No, that's really interesting. Thank you. Diana, how about your response?
So I think that the data is available in most of the places. We just need to generate a way that the information flows in a regular basis so we can have a broad view of what's going on. And I think in my wish list, I will, of course, ask for the sharing the data, but also to analyze the data and actually generate an action and trigger action. Because collecting data for collecting data is not enough. The data needs to be analyzed, and in public health, it should trigger action because you detected an alert, so you need to early respond to prevent larger outbreaks or control from a small neighborhood before it becomes a city-wide outbreak. So I will talk about the integration of data as it was also mentioned. So we need the lab, we need clinical data, we need to know the amount of severe cases or the proportion of severe cases in a specific setting. If there are some changes in the transmission, that is also very important. But mostly that the information that is available is analyzed early on time and it generates and trigger actions. Thank you.
Wonderful. Ollie, over to you.
Yeah, so very much from a researcher perspective, I suppose. I think the information that generally the quality of the information is basically amplified if it can come from over longer time periods or over more geographic regions. The more detail and the more kind of breadth and length you can get, it's much more powerful to gain insights. So I think, there's often a focus on, building new types of information now, whereas there's a lot of value in going back historically and trying to rescue data that might have been lost in paper systems or lost on someone's computer somewhere. So never underemphasizing the value of going back in time and trying to make sure you have that data. The other part is also information that we very rarely get, which is information on the system that generated the data. So in this case, it's the surveillance and case diagnosis and various other things that you don't typically get in a public report. So it doesn't even need to be hugely detailed. When were there major changes in surveillance or case diagnosis? And all of that can help the comparability of those really rich historical data sets, which would be really helpful.
Wonderful. Thank you so much. And so within this call for collaboration, and given that we have a few questions in the chat that are specific to your different platforms, the first one I'd like to ask is a really great question here from Nikki Kitty, tuning in, I believe, from Singapore. Does the GLI, the Global Arbovirus Initiative, offer working groups either focused on specific regions, diseases, or even the different pillar groups, so that we would know who to contact for areas where we have expertise? And I'm assuming that's someone who wishes to, or anyone who would wish to partner and support the initiative.
Yes, absolutely. So we have the different pillars. We have the Global Arbovirus Initiative web email address, which is gli@WHO.int. So please feel free to contact us. We have our technical advisory group on arboviruses, which is about 20 people from all the regions who are supporting the updates and the implementation of the Global Arbovirus Initiative. And we have experts from each of the different components. However, depending on the regional priorities, we need to focus in one or other arbovirus or in the different pillars, depending where the main gaps are. So please feel free to contact us, and happy to discuss a little bit more in how to bring your expertise in the implementation of the GLI.
Thank you, Diana. And just coming back to that beautiful dashboard that you unveiled for us, is Neela Mikbal and Ashley Shi were asking, is the database publicly available? Are the maps also publicly available?
Not yet. Because now we need to, and I'm calling to Oli, we need to move forward to the validation of these maps. So this is the first draft, and now we want to start validating in some of the countries. We have a list of about 10 to 12 countries from all the regions to start with, and of course Brazil is in the list, and many other countries are on the list. And the idea is to start validating this information, because as WHO, before we publish, we need to consult with the different countries if they agree with the data and how good it fits. Probably it will be very good, but we need to go to a process of validation. Once that is validated, then it will be publicly available. And otherwise, we can publish if it's needed, because now tomorrow, as we are having several outbreaks in the West African region, and we have large outbreaks of dengue globally, there might be a need to make these maps available. And then if that's so, it would be with a big draft title on the top, but they might become available. But the idea is to go to the process of validation first. And hopefully by mid next year, the latest, they will be fully published, not as a draft.
Wonderful. Thank you so much. A couple questions for Oliver and Open Dengue. We want more. So firstly is a great question from Theodore Tsai. I see you've replied in the chat already, but just for our other colleagues who might not be using it at the moment. In future, will Open Dengue display data by subnational boundaries? In particular, in context that WHO recommends the dengue vaccine for implementation only in high transmission locations. And also a question also from Nikki Kitty. Does the data include vector information indicators that could be leading ahead of actual cases? Is that something you are considering to expand?
Sure. So at the moment, we're limited by what countries publicly report. I say limited, it's still not that limited. Yeah, 39 countries report subnational data, which is great. And some of those at very high granular levels, like Brazil. So already we can say things about long-term trends there that may be of relevance to vaccine strategies. And I think that's an example where if we show what we can do with countries that are able to share at that resolution, they can see the benefit, and we can hopefully encourage more countries to share at that scale. We've not yet got any information in there about vectors. At the moment, it's very much an epidemiological database. I think there's probably some concerns around exactly what measures and over what things. So it sounds like a larger job to include vector data there. But as we've seen, there's lots of people in this space building different databases. So yeah, good opportunity for a new project.
Wonderful. And I suppose ultimately, when we look at these platforms, we want data, we want the analysis in order to lead to action. And that's something that you just alluded to, Diana, a few minutes ago. Turning to you, Leo, with that really great explanation of how this is embedded into a very solid framework in Brazil. You were comparing it to here, the NHS in the UK, but how do you perceive your resource being used directly to support implementation? Can anything be done to facilitate that or accelerate it?
Yeah, sure. Well, our system is being used by some different levels, from city levels and Ministry of Health levels. Like, we point that something's going on, they look at it. So they have that in the document saying, like, look at the InfoDengue website and see what's going on. So something like that. But they take actions depending on what's going on, and the InfoDengue just helps what's going on, because we do this real-time analysis. But it's just a couple of cities, because it depends on the technical. It depends on the surveillance team to understand what's happening, what we are doing. So it needs some training. And some big cities, they have plenty of epidemiologists and statisticians that they are they can look at the data and do something else. But we are trying to facilitate or make things easier to people that are not understanding the statistics and in this part of the thing. So we are trying to help them in other cities. And also when we find out something, we contact the small cities. Look, there's something going on in a city, you know, like, so we try to do that. And so I think that's it, that we are trying. There are always like the people are looking at what we do. We also try to contact the health secretaries, and we try to do that. But it's not that easy when you have 5,000 cities looking. But we do.
Fantastic. Diana, would you like to add to that?
So I think that feedback of the information and the analysis is key. And when you have, for example, you have the different types of alerts, so the red, the yellow, the green, and it will be good to know, well, when it's in yellow, which activities do I need to implement, which is the minimum. If it's in red, then which additional activities should be implemented, because that makes a difference when there are specific protocols where the data, where it's not just the color, but it's like based on this color, then these are the actions that should be implemented. Sometimes it helps, and it can be automatically. So when you have 5,000 municipalities, and you might have, I don't know, in the dengue season, 1,000 with dengue transmission, it's difficult to contact all of them. But if the tool that is generating the alert or the early warning system gives a minimum amount of actions that should be triggered when it's in green, I imagine that in green are the regular activity, right? So risk communication, community engagement, like basics. Then when it goes to the yellow, then there are additional activities that should be added, and so on. So if you have a specific guidance of which action should be triggered by different risks, that could be helpful for the countries. And I think that's a good way of increasing reporting from in the granularity that we want. Because if they are actually seeing that is a support and it's a extra help for them, because a system is actually detecting the alerts and they don't have to run it manually, because in many places in the world, they still do reporting on paper, and someone needs to type the information in an Excel spreadsheet, and then they need to do using the graphic tools of Excel, trying to check how is the epidemic curve going. So we have very heterogeneous surveillance systems and also capacities in the local and national levels. And then if we can fill that gap between the different levels and bring the analytics to the local levels where they are mostly needed, then we might be able to prevent and control outbreaks in the local and avoid further spread.
Wonderful, thank you.
Can I just comment briefly on that, Marina? Just
yes.
One small thing to add. I think the exciting thing, at least for me here, is that, as Diana pointed out, there's so many different systems coming through that could potentially, say, do situational awareness, what's happening now, and a bit of nowcasting and forecasting. I think that's really exciting as a research agenda. I think the work that needs to be done is now at country level. They need to have a kind of systematic plan about how they interpret all these different signals and translate that through to control. Because we don't want it to be ad hoc. We don't want it to be that the minister just happens to have seen this web page and is now concerned about it. We want kind of them to integrate all these different messages and ideally pair it with their own thing, like in Brazil, where you have a system that fully understands the complexity of that surveillance system and make a systematic decision around how that relates to certain kinds of control.
And so building on that, obviously you have been working on these platforms for a long time, before many articles in the press were worried about, is dengue coming to Europe, and before kind of a more generalized panic started to emerge. And I'm assuming that you had a lot of maybe users working in dengue, in infectious diseases in mind when you were building these platforms. Oliver, you mentioned the Johns Hopkins graphic and software for COVID and the pandemic, and how that got taken up and used by so many different kinds of users. So just to kind of bounce off your last comment, 2023, not a good year for dengue. Unfortunately, moving forward, likely to be as bad or worse. Do you have plans to talk to an audience that might change very quickly moving forward? Is that something you're considering when you're building your platform through various updates and iterations? Or how do you see the future of use of your 3 different platforms? Again, I'll probably go in order of speakers. Leo, you first.
Sure. Well, I think it's giving out these platforms in different levels, but I think one the thing that came to my mind is to do forecast, and to try to combine this forecast with climate information, to all different sorts of information, to have better forecast, to understand what's going on next year, a country, for instance. And then, well, we are in a El Nino event now. So what's the impact of the dengue cases for the next year? It's probably going to have something. I don't know if it's going to be more cases in one place or less cases in another place, but we could try to estimate that. We could try to forecast that if you have data. And if you have data, but because the climate information is really good, we need to have good information for dengue. So I think that's those initiatives are trying to do. So what's Ollie was doing, what Diana is showing us, I think, using those data to forecast what's going on and try to anticipate. Well, I know that's going to be an outbreak, so I need to act before to avoid that. I need to get my predictions wrong in this case. Like, I want to forecast that something's going on and people act, and that thing doesn't happen. That I think my aim.
Got it. Yeah. Thank you, Diana.
I completely agree. So once you have the baseline information and you know how the transmission dynamics is in the global level, for us also it would be key to be able to forecast and also model potential epidemic and pandemic scenarios. So let's say Zika virus is back, right? And then we have a large outbreak in a specific region. I don't want to say one. And then when we have baseline data and we know where the places are at risk or where the hotspots might be located, it will be easier to start implementing the actions in those hotspots that might be affected first, and then scale up, right? And the same, there was a question about the vaccine, the dengue vaccine. So when you know where most of your transmission is, and there are other modelers working, for example, with force of infection, so then you can bring all this information together and see which will be the best areas to vaccinate, because they have it's a high transmission setting, and you can assume that the seroprevalence of that population is higher than, let's say, 70% or whichever recommendation the strategic advisory group in immunizations is giving, right? So this kind of, when you understand what is the baseline, which is the base circulation of these viruses, then you can start estimating potential scenarios and what will happen if we introduce an intervention, and what could be the potential effect if the efficacy of that intervention is X%. So it has many applications as I will see from the global level, but in the local level, still there are many things that can be done because it will trigger action. So depending on the data and the level that each person is working, then the benefits are going to be different.
Thank you.
Yeah, so just from me, so I suppose, I think it's a really good question around, what users are potentially interested in this. I think I always approach this with the researcher's hat on and thinking, what's the use of the researcher for this? It's just narrow-minded. I think the real advantage here, what's new, is just the scale of this. So both kind of, really longitudinal databases and at a global scale allow us to answer questions about much longer-term drivers of dengue. And I think that's what will be substantially improved by these databases. A lot of really interesting questions around climate change and global change that will become a lot more tractable with databases like this. The flip side of that is that whenever I talk to people about open dengue, there's a strange, massive amount of public interest in this kind of data, and they're not interested in all the modelling or all the detailed stuff we do. They just want to know the data around, what's happening now and how does it compare. And I think it's easy to lose sight of that and the amount of work that goes into even understanding what's going on now. So there's kind of value even before you go into the complex science.
No, absolutely. And, that's why we're so grateful that you came today and you really showed us the immense body of work that goes behind providing this map, which is really what a lot of policymakers just want, or even the public now, and this appetite for understanding public health and infectious disease outbreaks and what might concern them or not. But we certainly are very, very grateful for, as you say, the incredible amount of work upstream that goes into this. We've learned a lot today. It's been really enriching. I am sure all our audience will go and explore the platforms as soon as they can. There's been a lot of references as well to speakers who have been at ISNTD, whether that's Rafael Saldana, who was with us just a few days ago, precisely talking about integrating data and disease and data. Disease and climate data, and how to use this through his platform and his R packages, all the way to climate and health issues. All this is available on our YouTube channel, so I've just put a link up here for anyone who's interested in delving a bit more into all these immense projects that really can use and benefit from this software. And there's never enough time, so it's really with sadness that I bring this session to a close, but we're immensely grateful for your time today. Thank you so much for the audience who tuned in, who was clearly very engaged, very appreciative and impressed by these platforms. And we will be in touch and keep an eye on all your incredible projects over the next few months, and very keen to collaborate and participate as much as possible. So thank you so much. And I do apologize that it looks like I'm speaking from a very dark cave and cavern, but I forgot how quickly the sun sets at this time of the year in London, and I did forget to switch on the big light. So my apologies for that. But anyway, on that note, thank you so much, and let's keep in touch.
Thank you very much.
All right. Take care, everyone.
Thank you very much.
Yeah, thank you so much. Bye.